60 knots.
Check.
V1, rotate.
Are the mics on?
The mics are on. Hello, everybody, and welcome to another episode of the Blue Skies podcast. Today, we're joined by Dr. Sean Peterson, who we met on a random coincidence, but we found out a lot about his career, and we think it'd be really interesting for you listeners to get into today. So instead of myself kind of explaining a little bit about what you do, Sean, why don't you just introduce yourself and who you are?
Yeah, well, Aaron, thank you so much for having me here. And Tricia, thank you for having me as well. My name is Sean Peterson. I'm a captain on the CRJ 900 at Jazz. Been doing that for just under 2 years. And it's been a career change for me. So prior to this, I was working full-time as a family doc, emerge doc in Sarnia. And always had the passion for aviation. Got my license about 25 years ago and got my commercial license just shortly after that, but never used it. So all the flying I did prior to this was flying for myself and flying the family and flying for business. And it was only in the last sort of 3 years I thought, my dream I had as a kid as being an airline pilot, that actually is achievable now. I have the hours, I have the certification, let's go for it. I have a great team back in Sarnia that is looking after the practice, a couple of locum physicians working for the practice full time, so that's nicely covered. And that gave me the opportunity to pursue this dream of being a pilot commercially. And that's what I've been doing for the last 2 years.
Very nice. Is this practice your own practice?
So I have a family practice back in Sarnia that it's currently being looked after by the 2 locum physicians. And there's a long-term plan for them to take over the practice and free me up to continue in my career in aviation.
Very nice.
So it seems like aviation stuck with you from a young age and has just sort of continued slowly in the background until one day you decided, let's go for it. What drew that first spark towards aviation?
Yeah, so aviation, my dad was a big aviation fan, never was a pilot, but we lived in North Bay. And we always had both the American and the Canadian air shows coming through. So we would be at every couple of air shows a year and really enjoyed aviation. My bug to become a pilot was on a trip I did from Canada, Toronto, over to Switzerland, my sister and I, back when we were a teenager. And we were invited to be aboard the flight deck during the flight. So we got to experience that on the way over to Switzerland. On the way back, the same first officer was coming through the terminal. He goes, "Oh, it's Sean and Aaron." So he spoke to the captain. He goes, "Would you guys want to be aboard flight deck for takeoff?" I'm like, "Yes." So we got to be aboard the flight deck for takeoff out of Zurich and climbing out over the Swiss mountains and over Eastern Europe and just got to experience that. It was just absolutely mesmerizing for me. And that's when I got the bug saying, I could be a pilot. Yeah. So it was that first invitation into the flight deck. And of course, this is pre 9/11 when you could go visit the flight deck mid-flight. So it wouldn't be long after that. I think it was really just a year later that I started my private pilot license.
And what did Erin also get the same bug, or is she on a...
No, she's, so she never got the flying bug. She enjoys to travel, though.
Nice, very nice.
Yes.
Love them.
So interesting that everyone we talk to always calls it the aviation bug. Like it's something you catch and you just can't get rid of.
Yeah.
It just sticks.
What about medicine? And was that ever also a bug for you? And then you just ended up pursuing that pathway instead? Like, how did that fit into the story?
So I have lots of passions. And early on in my life, got exposed to the medical system and saw the work that physicians did and thought, hey, I want to do that. I like to help people. I like to make a difference in people's lives. And I pursued engineering initially because you need to have an undergrad before you go to medical school. So I did engineering first, aerospace engineering at U of T, and then went on to medical school after that. And enjoyed my career in medicine, practicing emergency medicine, family medicine, and intensive care medicine. But yeah, rewarding career, but I was looking for a little bit of a change, and that's how I found myself in aviation.
Did any of your aerospace engineering theory come back to you now when you re-entered the industry?
I think it does.
Okay.
Obviously, flying is much more practical than the theory of fluid dynamics that would have been 25 years ago, right? So, but it does come into play. Definitely when I think about my systems knowledge of the aircraft and the design process, I think that obviously helps have a deeper understanding of the aircraft, which helps in decision making when you know the aircraft to a better depth than you might otherwise know if you didn't have an engineering background.
As a pilot, you're kind of trained to be a little bit of a jack of all trades with, high specialization and flying and procedures. But in your background now, you have that engineering and systems knowledge. You also have the medical knowledge, like human factors. Mm-hmm. And now you have this whole other side of flight training. You must have a very long resume.
Mm-hmm.
How long did it take you in your career to kind of get where you are now?
Well, I mean, if you do the math, I'm going to be turning 50 next year.
Okay.
So, undergrad started at age 19, so you can do the math there. And that's, what does that work out to, 31 years almost? Yeah. for me, I still feel like I'm in my 20s, and I simply just follow passions and follow, where my heart and my desire takes me, and I love to learn. So it's been a lifelong learning journey for me, and it's whether it's in engineering, in medicine, in aviation, I just enjoy learning, and that's how I got here. And my advice is follow your passions and do something you truly enjoy and provides you, reward. And if you're not finding that reward, think about what might and how to switch it.
So age does play a big role in our industry compared to other industries when it comes to retirement and at what age you start. Was that ever a factor that you considered, that you were starting aviation a little later down your line?
It wasn't.
Okay.
You're absolutely right. Like, definitely, if I'm coming out of flight college, I'm in my 20s, the earlier you get into an organization, the better your seniority, the better it's going to be long-term for schedule, the earlier you can retire. That all makes sense. But I never approached my career or my learning about, this is my plan to retirement. I really just said, this is what I want to do because I really enjoy it.
Okay.
I don't see a date that I'm going to retire.
Yeah.
For myself. If I'm still enjoying it, I'm still going to keep doing it. So my plan is still practice medicine part-time, do aviation full-time, and when it's no longer rewarding, that's when I'll retire. Yeah, exactly.
When you first got your PPL, did you ever have dreams of becoming an airline pilot then?
Yeah.
And you just kind of let it sit for a little bit? Did you think it was unachievable at that point?
Always had the dream. I mean, I have the 6x4-foot poster of the flight deck of a Boeing 777, which had just come out back when I was doing engineering school. So I saw that poster and I looked at it daily in the garage. I'm like, my dream was, I'd love to fly that someday. But it definitely, back when I was 20, it was a dream that I never thought would be achievable. So to be here now and kind of saying, wow, that's a potential, that's a possibility, is pretty cool. So yeah, it is coming back to that initial dream of, hey, I'd love to be an airline pilot, and here I am.
And why did you believe it was unachievable then?
I guess back then it was number of hours needed. So back when I was doing that, to be hired at an airline, you needed, probably 5,000 hours to be hired. So me with a PPL and, 75 hours, there was a big gap between there and being an airline pilot. So at that time there, I was doing engineering and was pursuing, work in the engineering field. So it was a dream, but it wasn't one that I was actively pursuing.
I see. Well, then you look on the flip side, and then your engineering to medical side also, I imagine, takes a long time to get into a role in a career. So how'd you make that distinction? Did you know that you were eventually going to go into medicine?
The plan coming out of high school was to eventually get to medicine. I chose engineering in case I didn't get to medical school. It's pretty competitive, and I love math and physics. So I figured, okay, listen, if I can't get to med school, do engineering, and it's a career I'll very much enjoy as well. Yeah, so the plan for medicine was always there. I did engineering. I took a couple of years off after engineering and worked as a consultant, and then went back to med school. Kind of gave myself a little bit of a break. So it's been a journey of, go do some schooling, do a little work, do some schooling, do a little work, kind of throughout my whole life.
Speaking about management, let's talk about time management. So being a captain at Jazz on the RJ, as well as a CAMI, and having your practice back in Sarnia, how do you manage all the time, and how do you deal with the stress with all those responsibilities?
This is where the crew resource management in my own life comes into play, right? This is the leadership and the communication and having a whole team. So the only way I can do this is with people back home supporting me. So I have a partner that's supporting. I have my family that's supporting. I have my whole team back at the medical office that supports. So by having that whole team, we would have a nanny that helps out at the house too. So it's a village supporting the family and supporting me so that I can follow my passions and do what I want to do. So there's obviously some give and take there, and kids find it a little bit challenging sometimes when I'm away for 3-4 days. But I really focus when I'm home with them, and I focus on their activities so that when I'm home, I'm fully present, and when I'm away, I do my work.
So you're actively flying. You're also a CRM instructor, and you still run your doctor's office in Sarnia all at the same time.
Correct. Although the work in the office is mostly taken care of by the team there, and I have 2 full-time physicians. I'm not managing the day-to-day. It's more the high-level management of the organization.
Nice.
Yeah.
Let's speak a little more about your parental role with the kids and being away. That is a stigma that we've seen through many people on this podcast, and managing time at home. It's a big hindrance to many to join the industry, which is something we're trying to tackle with the use of this podcast. Can you speak a little more to being away and being at home. What do airline schedules look like for those that may not know? And any advice or things that have worked for you and your family that you would suggest to others?
Yeah, it is a challenge because in aviation, you are away from home multiple days a month. There are some positions where you can be living at home and maybe do a day trip and be back home later that day, but that means you need to be living at a base, whether it be Toronto for Jazz, whether it be Toronto, Montreal, Calgary. But if you're not at one of the bases, then to try to reduce drive time, it makes sense to be away for 2-3 days at a time. So from a family perspective, it's about having a schedule that we can make work. So making sure that there's coverage for the kids in terms of their overnights, making sure that there's someone to drive into their activities, so making sure that all logistics are covered. But then on the other side, I really make use of people to help me out at home to get the chores done as well. So that when I'm home, I'm truly just home with the kids. Like I don't have 1,000 chores to do at home. I can really just spend time with them and play games with them and engage in their activities, go watch their sports. Mm-hmm. There's a good book that I read, and I do follow this. It's Tim Ferriss's book called The 4-Hour Workweek. And his whole concept in that book is anything that someone else can do, you get them to do it. So you replace yourself so that the task that you don't find greatest enjoyment from, someone else is doing. It means you obviously have a lot of expenses, but what you're buying yourself is you're buying yourself time. And that's really important for me. So buying that time so when I'm home, I'm truly with the kids is priceless for me. Mm-hmm. So yeah, Tim Ferriss's book really helped kind of solidify that down, that, replace yourself, hire people to support you in doing what you need to have done to free up that time to do what you love.
And did you always manage your kind of week-to-week life in that way, or did it start off a little bit different and you realized you needed to make a change?
It's probably been evolving over the last maybe 10, 15 years that way. Like even in my family practice, I started off with a practice of maybe about 2,000 patients, and then it kept growing. In Sarnia, we have definitely a lack of family doctors. So as doctors would either move out or unfortunately die, there's suddenly be a large block of patients that need to be taken care of. So in that case there, I would take on a chunk of patients along with some of the physicians and then hire a team to provide care to the patients. So in my practice, I was one of the leading physicians providing team-based care, where it's not just the doctor, rather you have a team of physicians, nurse practitioners, nurses. And our motto in the office was not every problem needs the doctor, but every patient definitely does. So that you have that whole team. And by doing that, we as a team could be more readily available to the patients. So they had access, they had quality care, their issues were taken care of. And when they needed the physician, they were able to see them, right? So I would see the patients with the most challenging issues. So the new diagnosis of cancer, the end of life discussions, the advanced mental health challenges, those that have addiction issues, those with advancing dementia, the more difficult, challenging cases I'd be involved in. Whereas some of the more simpler issues, I have a sore throat or an earache, one of my nurse practitioners or nurses might help with that. So it's a good model that the provinces are looking at, how do we do team-based care so they can leverage this concept so one physician can care for 4,000 patients, not the current average, which is 1,500. Wow. Yeah, so the same principle in family medicine also applies in life.
And with that balance, you feel that, are you happy with the way things are now? Do you wish you spent more time in one area or another?
Yeah, I guess I do miss the time, some time at home with my kids. So I try to maximize that. Some things, you asked earlier about airlines, and different airlines have different rules. You can try to bid for a reduced schedule. And that's what we see for some of the pilots to do a reduced schedule. So instead of working a full schedule, you might work a 75%, or some jobs even have a 50%, even a job share. So different airlines have different options there to reduce the time away. Of course, there's a reduction in pay with that, but what you're getting time at home. So I try and make use of whatever I can to reduce my work hours so I can be at home.
I see. So for anyone who's listening who's contemplating a career in aviation or maybe making a switch to a career in aviation, what you're saying is with correct management, it is possible to still spend your time wisely. And
it is, absolutely. There's always a cost, right? There's a financial cost if you have other people doing your chores and stuff. Well, there's a cost there. But if you can build the business case for it, then it makes sense. So my advice to everyone is live within your means. Don't overspend. Use that money to buy experiences for you and your family, and use that money to free up time.
How do you think your aviation and medical career influence each other? Do you find that because you're a doctor, that makes you a better pilot, or because you're a pilot, it makes you a better doctor?
I would say both. And it's really interesting. If you look at aviation, we have Advanced Safety Management System, SMS, which is the cornerstone of aviation safety for the last 30, 40 years. And that's been instrumental in reducing the number of incidents and accidents in aviation to a level that's one of the safest forms of transportation ever. But it's only through that SMS system that we've got to this point. So we have the redundancy of the aircraft, but of course we have the human factors aspect, using safety management systems and crew resource management to get that additional level of safety. Unfortunately, in medicine, in aviation terms, we're still in the 1980s. All right, so we don't have safety management systems. We don't even work with interoperable systems. So communication between a hospital and a physician or two physicians is limited. We're still working in faxes. My office still gets 100,000 faxes a year. It's 2025, and I have 100,000 faxes, which of course brings in data that is now no longer searchable. It's not in a standard format. It's not in a proper field that can go into the medical record system so it can be searchable in the future. So we have a long way to go in medicine to catch up to the safety level of aviation, which is ultimately ironic, right? It should be the other way around. Our health is, I'd argue, more important than our travel, but our health system is decades behind aviation. On the flip side, I transitioned to being a captain relatively quick in my career as an airline pilot. That said, I did bring over 2,000 hours of single pilot IFR experience to that world. So I have 2,000 hours of decision making, and really whether it's one person in the plane or it's 80 people in the plane, the decisions are pretty similar as to where you're going to go. You're thinking about the limitations of the aircraft, limitations of yourself. What's the safest plan A, plan B, plan C? And that really is no different in airlines as it was when I was doing my own flying in GA. But by being a physician, it also gave me practice in that decision-making, additional decision-making where it's life-threatening decisions, high risk, lots at stake. So that transition to being a captain at the airline was much easier, I think, because of my medical training.
Since you're still very involved in both the medical field and the aviation field, and you notice this lack where medicine is still in the 1980s, is there anything that you are capable of doing? Like in your own practice, do you try and make changes where you can?
Yeah, excellent question. Absolutely. I've put in place, and the team has also put in place additional safety factors to try to improve our overall safety. So most physicians' offices, you get a series of inbound labs, and it's usually a paper chart, and you have to read down and find the abnormals and decide, do I need to do something with that or not? As you can imagine, a sheet of paper with a bunch of numbers, and you're looking through 200 of these a night, it is really easy from a human factors perspective to miss something. So what we put in place now is all that data goes into the EMR, and we do a cross-check across the entire practice every week, looking for critical values that we might have missed. And then we do another level search every month. So we're looking to pick up anything we might have missed on that initial pass. So it would sort of be the equivalent of sort of a flight data analysis system where you're going through and double checking the data. We have in place as well within the office SOPs, standard operating procedures. So that mirrors the airline industry. I've touched on teaching with my team, which would be some of the human factors, but also emotional intelligence and, customer service and interpersonal effectiveness. How do we work better as a team? Those type of teaching and training sessions, which would be also similar to what you see in the aviation world too. So yeah, it's definitely brought in some of that aviation to try to improve the safety and quality in the practice of medicine.
I imagine some CRM is also playing into that too.
Absolutely. And CRM, definitely in medicine, if you look at that, it's, you have the patient, you have a physician, you might have another physician, you have a family member, you have multiple people involved. And at the center of CRM, of course, is communication. So yeah, that's an important skill set. I'd argue independent of any industry you're in, it's important to have CRM skills.
So it seems like aviation and medicine, for at least your experience, has benefits to each other, which is nice to hear. However, there is still a lot of stigma and anxiety between both, I guess, areas when it comes to pilots, especially around just the pilot community being hesitant to disclose certain things. And maybe it's just the lack of knowledge towards one or another. But what do you wish more pilots understood about more of your aviation medicine side of what you do?
Yeah, fair question. Obviously, for pilots, we need pilots who are fit to fly. And the key thing that aviation medical examiners are looking at is what is the risk of this pilot having an incapacitating event such that they couldn't control the aircraft? And that's really what we're looking for. So most individuals don't have a condition that's going to be a potential for sudden incapacitation. So for most people, hopefully the aviation medical exam is should be a relatively straightforward process. And for most patients, most pilots, it is. There are pilots that do have some medical conditions that need some further investigation. But what I would suggest is, your aviation medical examiner, we all want to see a pilot fly. None of us want to see anyone grounded. And especially if it's an aspiring pilot, if there's a pre-existing medical condition, we'd like to see if there's a way to get them approved for flying. And even if someone doesn't get a fully unrestricted license, they might get a restricted license that might be a shorter duration. So as opposed to having a 5-year renewal, it might be a 2-year renewal or a 1-year renewal. And that just means that the regional office wants to have a bit of closer eye on that pilot just to make sure that they're still low risk and still safe to fly. So the advice is, if you want to fly and you do have a medical condition, apply, have the committee review it and see if you're suitable to fly, see if you can get approved. So when I have pilots come in to see me for their first medical and they're saying, well, I don't know if I want to fly commercially or privately, I usually suggest, well, apply for your category 1 medical, which would be what you need to fly commercially. And that way, you already have it. And if it's already approved and you only get your private, no worries. You just use that. But in the future, if you want to be a commercial pilot, it's sitting there ready to be used. The other group of pilots is if something's popped up. I've had this intervening issue. So our obligation as pilots, if we've had a major medical issue pop up, we are supposed to ground ourselves until we see an aviation medical examiner to review what's happened. And sometimes as medical examiners, we can tell the pilot, yeah, you're good to fly again, or we'll collect the information needed so we can get that to Transport Canada for their review. But we really want to work with the pilots. We want to get people in the air. So we'll coordinate getting, the documents, get them submitted to regional, and in some cases, try to get things expedited, especially if it's someone's job is on the line and, they're currently grounded. We'll obviously go to bat for people too.
What's that process like working with Transport Canada, where it's not just between, I assume with your practice, it's a lot of the physicians and the patient, and it's a lot of communication is very direct between the two of them, but with being an aviation medical professional, now you have this other governing body that you got to also flow information through. Does that hinder a lot of what you do, or explain that? Like, how does that fit in?
Yeah, no, I don't think it hinders my duties, if I'm seeing an aviation medical pilot, it is a different structured assessment than it might be if it was just in the regular office for family medicine. So the whole context of the aviation medical exam is to do the exam and pass on that exam information to Transport Canada and any supporting documentation, address Transport Canada's questions if they have a question about the exam, and really try to facilitate that for the pilot. And then Transport Canada will do their review and come back, and sometimes they want more information, so they'll send the candidate a letter saying, hey, go see your family doctor. We need the following items. We submit those back to your CAMI and we'll re-review you. So, we're here really as a conduit to Transport Canada, which I think is good because that's a big organization and it's hard to know who to contact.
As a pilot yourself, do you believe that, or do you feel that pilots generally don't look forward to their annual medical exam? And if so, why? Are there any misconceptions about the medical exam that pilots feel with all the questions they ask? Do you drink alcohol? Have you been in an accident? Has anything happened? And they're afraid of answering a certain question.
My advice is be truthful. That's good advice, I think, in life in general, but be truthful. If something has happened, let's get it on the record and discuss it. My advice to pilots is don't smoke marijuana ever. We have a 30-day exclusion, or Transport Canada has a 30-day exclusion from when you smoke or use marijuana and fly. But generally speaking, the effects of marijuana are long-lasting. And for myself and the aviation medical community, it doesn't make sense for a pilot to be using marijuana on a regular basis. That's just not compatible with flying. We need our pilots to be cognitively alert. So if you want to be a pilot and marijuana is in your life, I'd say get rid of the marijuana first and then apply for your medical. From an alcohol perspective, there's lots of issues outside of flying with alcohol, and regular alcohol use is linked to increased sleep disturbance, increased levels of depression, anxiety. It's linked to increase the risk of cancer. So there's a lot of reasons to be moderate, to have moderation in your drinking as well. And I think that applies to pilots. Most pilots I'm seeing, the alcohol is not an issue, either the reporting or that I'm suspecting.
Mm-hmm.
And as a CAMI, do you ever step into the world of mental health? Do you ever face any issues with that or talk to other pilots about that?
Yeah, we do. Mental health is a big issue. We've seen increased rise in mental health in general in the communities, especially post-pandemic. So definitely seeing an increased rise in that. And we said in the population of pilots too. And many pilots have stigma around reporting that too. My advice is, if you're not well, get some help. Go see your family doctor. If you're having depression, you're having, anxiety, or you're just not coping well in life, we need pilots to be healthy. And somebody who gets healthy, there might be a period of time where they're not flying, but then once they're healthy, Transport Canada looks at that, and in many situations, they'll be back in the flight deck.
Have you found in your personal experience that there has been a rise in reported cases with mental health, or is it still very suppressed in the aviation community?
It's a good question. I don't know the data on that. It'd be a good question at the regional level to see if we're seeing increased reporting. I'd say I have a slight increase in the last couple of years of reporting mental health issues, but I think generally speaking, pilots are reluctant to bring that up with their aviation medical examiner, because it does open up a whole door of questions as well, right? As to, is this individual safe to fly? So my advice to the pilots is, talk to your family doctor. And I always suggest that your family doctor is different than your aviation medical examiner, so that you have that trusted relationship with your family doctor that is separate from the regulatory requirement.
Can you speak a little bit about what the process is moving into the airline industry and their medical evaluations and their psychological evaluations, the role that they play and why the industry does it, and kind of what you could expect if we have any listeners that are preparing for one of those exams, perhaps?
Yeah, so the airlines, they do have a more rigorous approach when they look at medicals from both a physical perspective and, as you mentioned, a psychological evaluation. The psychological evaluation, it's really looking to see, are we seeing aberrant psychology? So you can imagine there's certain personality traits, psychological features you wouldn't want in the flight deck, right? And, there's some pretty obvious ones in terms of psychopathy and such like that, but also other traits. People that are completely rigid in their thinking and can't take into consideration other people's ideas to work as a team, that's going to be someone who's going to have a challenge in the airline industry, right? So someone who also has challenges with not always being correct.
Yeah.
If I'm rigid, I always think I'm always right. That's dangerous because there's times I might be wrong. So that's really what the psychology is looking at. My advice on that one is answer the questions truthfully. It's designed to be internally consistent. So they'll ask the same question multiple times. So just answer truthfully when you approach those type of questions. And the whole reason the airlines do that is they want pilots that are going to be safe, good working team members, and also have a long career with them. So that's why there's additional, scrutiny from that perspective.
Why do you think that applies only when you get into the airline industry? Why isn't this something that they implement a little sooner on as a pilot?
It's a fair question, right? So the question comes up, would it make sense to do that before someone embarks upon flight training? I guess at that point they're not looking to join an airline. There's no employers don't have a vested interest at that point. Transport Canada hasn't approached that at this time. And it might be that someone would be suitable for a private pilot license, but maybe not suitable for flying for an airline.
Maybe like a risk assessment based on the resources they have available to see if that's a feasible option.
Yeah, because even when I look at like the 703, 704 world, there's not a lot of the additional examinations when it comes to that. But with 705, rightfully so, you're working with bigger groups of passengers and people. But it's very interesting, I guess, if at any point in the future moving forward, is that something that Transport Canada might look towards implementing for any aviation commercial job? Yeah,
it's a fair question. I don't know what Transport Canada is thinking about that. You could also extend that to other safety-sensitive positions outside of aviation as well, right? So if you want to talk about, railroad conductors and engineers, you want to talk about process operators at plants, you want to talk about nuclear operators at nuclear plants, all jobs that are safety-sensitive. I think the bottom line is we want healthy individuals. We want people who are well. So the advice to the pilot community is focus on your emotional wellness. And going back to a question that you asked earlier there, Trish, in terms of what can individuals prepare for when you're preparing for, let's say, a medical, my advice is, be as healthy as you can be, physically, emotionally, and mentally. So watch what you're eating. Do your 150 minutes of moderate to vigorous physical activity a week. Make sure you're getting proper sleep. Make sure you're attending to your mental wellness. If you're doing your meditation, you're doing your yoga, you're out with friends, make sure you're doing well in life. And if you're doing well in life, you'll do well in your aviation medical.
What do you feel the biggest challenges are for pilots who try to maintain their well-being while also in this field?
Yeah, so I can tell you, it's a challenge when you've been flying for 12 hours for the day and you're going to the hotel and you're like, I really should go to the gym, but we're all human.
Yeah.
And after 12 hours, it's pretty hard to motivate oneself to go to the gym, right? So that's the tough one is, making sure that you get that aerobic activity in. And maybe it's not when you get to the hotel. Maybe it's, okay, well, I'm going to get up an hour earlier tomorrow and run down and do that. For physical activity, I'm a big fan of the Bowflex, like an arc trainer. Reason being is it's non-impact, so it doesn't have the impact of the joints. You can do just a quick 20-minute run because you have both arms and legs. It's more of a cardiovascular workout, more calories per minute than you get running up by itself. So I'm a big fan of that.
Mm-hmm.
And, going back to, James Clear's book on habits, habit stack it. So make a rule that you can't watch your YouTube or your Instagram unless you're on the arc trainer.
Yeah.
So that you're kind of tying something you enjoy with something that you weren't necessarily looking forward to doing. So that the whole event is, hey, by the end of this, I did my workout and I watched some YouTube. I feel good.
And what do you do personally to be healthy?
I tie my YouTube to my arc trainer. Absolutely. So if I'm watching YouTube and, I'm a fan of a bunch of YouTube channels, especially involving aviation. Yeah. My rule is if I haven't done my workout for the day, the first 25 minutes has to be on the trainer. Then after that, I'm free.
I have an interesting question, but how does it work for camis I guess in your situation, you're also a pilot. Do you go to another cami to get your medical done?
I do.
Okay.
Yep. I'll go to another physician and have them assess me, and they assess me the same way they'd assess any other pilot.
What trends are you seeing in pilots today that didn't really exist maybe 10 or 15 years ago?
It's a fair question. I haven't been doing camis, aviation medicals that long. So I would say that the trend I'm seeing is I'm seeing a broader age group of applicants now for, let's say, the category 1. So those that want to be on commercial pilots, I'm seeing a broader range of applicants for that. Let's say 5, 6, 7 years ago, it would have been mainly those in the 20s, but I'm now seeing people of all ages, seeing more people looking to do that career change. So they're coming in to get the category 1 to say, hey, is this even possible? Let's make sure I have a medical before I go spend money on a flight training. So that's what it'd be the key trend I'm seeing.
How do you think that the medical requirements will evolve as the industry changes, and any suggestions you have for that? Like if there's a newcomer perhaps in the industry that is going to stick around for the next 30 years.
Be as healthy as you can be. It's the bottom line, right? So in aviation, we need to be healthy to keep our medical. So I would say doing regular activity, exercise, it's part of your job. For those that are in the military, they have mandatory physical activity throughout their week. I think for pilots, the same thing. Put in your schedule. Make sure you get into the gym, or doing some type of activity every, 3 to 4 times a week. Make it routine.
Yeah, it is tough because after a long day, you don't really want to do anything other than go to bed or eat something.
Salad, yeah. You want a greasy cheeseburger on your way to the hotel, yeah.
And finding healthy food is a challenge too, right? Especially if you're ending your day at 11 o'clock at night. The only thing that's open is fast food, right? So trying to find food, bringing food with you if you can, so that freezer pack, lunch bag with your freezer pack in it so that you have your fruits and veggies there. It takes a little bit more of planning to make sure you have the groceries in the house. But having that, I think, is important because we're all human and we're going to eat what's available.
Yeah.
So if there's veggies available, well, we'll probably eat those. If there isn't veggies, well, there's always chips available.
Yeah.
It's not ideal, right?
Is there a moment perhaps in your career where flying or medicine, either or, has taught you a significant life lesson that you kind of follow? I know you touched upon the book and the habits and how you implement that, but is there anything else perhaps maybe in the aviation side or either?
Yeah. So I think for myself as a pilot, I'm a pretty structured pilot. I follow SOPs. I do my own notes, and study notes that are, nicely formatted, and I carry those with me on my tablet. So even my study notes I had when I did my initial course, they're available to me in flight. So I'm like, okay, well, if I look up something, okay, I have the reference to that. So I think being that organized approach in the flight deck, I also mirror that the rest of my life. I like to have an organized life. So my schedule, as you can imagine, with the kids, 2 different jobs and social life, it's a pretty finely articulated schedule. And having that organization is what facilitates me to be able to do everything I do. So being organized, I think, would be one thing it's present in the flight deck, but I only got there because it also mirrors my personal life.
From listening to you talk, I can tell you're very busy and you also have your hobbies. You try to stay healthy with physical activity. You read. How do you kind of keep yourself away from temptation? Maybe that day you're not going to workout and instead you're just going to watch a YouTube video, or you are going to go for those bag of chips? How do you keep yourself regimented?
Well, let's not make no mistake. I have days where I eat the bag of chips. I have days that I don't do the workout. So, and those are okay days, right? You can do those, those days and shouldn't feel guilty about it, but it can't be every day. So I think the way to do that is by keeping your eye on what your goal is. So if we have a goal in life, working towards that goal, humans like to work towards something, especially pilots. Pilots are for the most part, are mission oriented. So have your goal in mind and have a clear idea what that goal looks like and envision yourself in that goal. So really your identity then is, okay, my identity is someone who's going to be an airline pilot. Well, what does that look like? Well, that's someone that is healthy, they're fit, they're well rested as best they can be. They have things organized, so they have the proper food. So envision yourself doing that. So when it comes to the day-to-day, when you have to choose between the bag of chips and the couch or the gym and hopefully a bit of YouTube, you can make the better choice for yourself long-term. And that's true of anything in life. It's making those choices that are good for the long term as opposed to the short-term gain, a short-term sort of satisfaction. But I struggle like everyone else.
Yeah.
Any, unexpected health tips you have, like no eating after 8 or no alcohol on weekdays or something like that?
I think we have to do what works for each of us. What works for me might not work for anyone else. So I think just keep your eye on the prize and do what works for you. And, if I am someone that is struggling with, every night I'm in the snack cupboard and I have my kids love my snack cupboard and so do I. One of the rules I have is, don't bring the food into the bedroom, right? So if it's nighttime, bedroom really should just be for sleeping. If you're going to be, watching TV or watching anything, do that in the living room. And if you're going to be eating, do that in the kitchen. So try to keep the eating to where it is, it's in the kitchen so that you're not bringing the bag of chips into the bedroom and enjoying that with your YouTube, right? So I think just keep your eye on the prize and setting a little bit of limits as to where you do certain activities. That way you don't form the habit, right? Because we form habits so easily as humans. And if my habit is always to watch YouTube and have a little snack at night, well, then I'll do that every night.
Yeah.
And by the time you do that, if your snack's 500 calories a night, well, that's over the course of a week, that's a pound of extra calories I've just consumed.
What advice would you have, kind of switching the topic here, but would you have for anyone that, similar to you, is looking to jump back in or start their career in aviation and are coming from a totally different background, and whether it be age or family or time consumption or the medical background and evaluations and how that plays a role in age, what advice would you have for that individual?
I'd say first off, think about what provides you the most joy in life. What gives you joy? And then determine, well, how do you maximize that time? And if that is doing the career you're currently in, maybe a switch to aviation, it doesn't make sense. But if you really love aviation, and let's say you've done your private pilot and every time you go flying, you're completely invigorated and you absolutely love it. And, definitely when I go flying and come back, I have a huge smile on my face. Knowing what brings you joy and what brings you fulfillment and following that is what I think is most important. So someone, considering a career change, there's a huge cost in doing that, both in terms of money and also opportunity. So to do that, you want to make sure that in doing that, you're doing something you're going to truly love, truly have that passion for. And I think for most of us, you talked earlier about having the aviation bug. If you don't have that bug, I don't know if I'd be doing this switch. But if you have that bug and you really have the passion, well, look at your plan. Can I financially do this? Can I support the family and do this transition? Or what do I need to do to get to that? So does that mean we need to downsize the house? Does that mean we need to reduce our spending? Do we need to do some savings before we do this? If I have a partner, can he or she support the family while I do my training? And have a proper plan in place and then work the plan. And I think being a thoughtful approach to it, but if you don't have the passion, it wouldn't make sense to go down that path, because in aviation, you've probably talked about in the podcast, starting salaries. If I'm starting the salary in the medevac world, if I'm starting the salary as a first officer at the airlines, some of those salaries, 40 to 65,000, like it's not a lot to live on. It's tough if you have a family to support with that. So you need to have a good financial plan in place to make sure it works.
As someone with so much experience, what do you love most about flying?
I love the idea, especially with the airlines, that we're connecting people. There's a human aspect and there's the technical aspect. And the human aspect, we're bringing people, we're connecting families, connecting friends. We're bringing people, to their new homes. So I had this one lady get off my flight in Charlottetown. Thank you for flying me here. This is my new home. right? So literally moving her to where she's now going to be living.
Mm-hmm.
That's pretty cool. That's the human touch. That's the aspect of, we're making a difference in people's lives. On the other side, aviation really, for me, fulfills the technical aspect. I want to be challenged at some mission that's technically challenging, has multiple variables that I need to manage with my team to safely get the airplane from point A to point B. And that gives me personal fulfillment from a technical perspective. So I think someone that gets joy from both of those, the human aspect and also the mission-oriented teamwork, accomplishing a goal, will really enjoy aviation. And that's what I enjoy in aviation.
It's a good answer.
Yeah. Well, looking forward, what's next for you? Are there more areas outside of medicine and aviation that you're excited to explore?
Right now, I'm having a blast in aviation. I'm enjoying combining aviation and medicine. And I do some teaching in CRM, human factors. I'm going to be doing some teaching for other single pilot IFR operators around safety aspects as well. So trying to ensure that we can, I can try to improve the safety for other pilots like myself that were doing GA. Right now I'm enjoying. So do this for now and see where it takes me.
Yeah. Do either of your kids have the bug for aviation yet by chance?
Absolutely. So both my kids, they're aged 13 and 12. And we used to have a Cirrus, an SR-22. And when we go flying, I'd have them hand fly and they'd fly with the flight director. And it's amazing with their experience in video games. They can fly the flight director. I don't want to tell anyone this, but probably better than I can. And they can fly to IFR standards having never done flight lessons. Right? So it's pretty cool to see what they can do. So they're actually both enrolled in ground school starting this Thursday.
Wow.
So they are starting a little bit younger. And what I've shared with them is, even if you do your pilot's license but never actually become a commercial pilot, it opens so many doors for me. So I did my private pilot back in undergrad. And every interview I attended for any type of post-undergrad education or any type of job, flying was the key discussion. And it differentiated me from the other applicants. And to the point that, I did my med school interview at U of T. And at that point, JFK Jr. just crashed. And the entire interview was about aviation safety, crashing, spatial disorientation. And they had all these questions about JFK Jr. At the end of the interview, and this is again for me to get into medical school, they said, "Oh, do you have anything else to add?" I'm like, "Well, do you want to know why I want to be a doctor?" You didn't ask, do I want to be a doctor? What's your passion in medicine? None of that was even asked. It was all about aviation. And so it shows that an individual can accomplish something. It can dedicate them to achieving something. It shows that they have hand-eye coordination, shows that they can learn technical knowledge, shows that they can perform under stress. So as a potential employer, someone who's done a private pilot license is a huge asset. You say, wow, I want that person because I know they can handle stress and technical learning and all that. So it really provides a demonstrable way of showing that they're a really good individual that would benefit any organization or any educational program. So I've encouraged both my kids to get their license, whether they use it commercially or even if they don't end up using it privately, at least it will open some doors in the future.
I agree with you on the fact that it does open so many doors. And I think just even the training itself of privates is very different than anything else you would experience at that age, at any age, I guess, in life. And you learn so much that you can then take and apply to any other career, I've noticed, or I feel. But yeah, that's great advice to pass along. I wish your kids luck and hopefully they end up pursuing it full time because it's a great industry.
Yeah. And, obviously, with my daughter, it'd be something pretty unique for her. She wouldn't have any classmates that are pursuing that. And of course, our whole purpose of being here is try to promote more women in aviation. So to see her go and do that and potentially be a role model and leader to others is very heartening for me too.
Yeah.
How do you think the industry will be different by the time they kind of reach where you are now, if they take?
That's a fair question. I mean, probably the biggest question that's in the industry right now is, at least in the airlines, is 2 pilots versus 1. Right? We saw the trend. We went from 3 flight deck crew members down to 2 for most operations. Will that go down to 1?
Yeah.
And that's probably the biggest question I think we see in the industry. The question about will AI come into flying? It's a fair question. I think the regulatory environment in aviation moves pretty slow.
Yeah.
So I don't think we're going to see that anytime soon. That's a good point. Yeah. And even you look at the 1 pilot versus 2 pilots, there are so many times in my daily flying an airliner where, I do make a mistake. Or my co-pilot makes a mistake, a first officer, but we catch each other's mistakes. and we trap those errors so they don't go on and propagate to become a problem. The average person, whether they're a pilot or a physician or a computer programmer or a receptionist, the average person makes about 7 to 10 errors a day in their job. And for most of us, that might be, oh, I sent the email to the wrong person. Yeah. Oh, I forgot that meeting. I forgot to log on. Right? Those are little errors, and they're not that consequential because it's a missed meeting, it's a missed email. But in aviation, much like medicine, every error is consequential. So by having those two pilots, it's absolutely essential for cross-checking and catching each other's errors. So I think it's going to be a long time before we see flight crew go down to one pilot. But that would be the one change I would think might be coming up. Of course, technology is going to evolve. You have more automation in the flight deck, more safety systems, more checking, more crew alerting systems. So it's going to be more of a managing the aircraft as opposed to physically flying it. That's where I see it going.
That's true. One thing I've briefly heard as well is instead of going down to one pilot, maybe it goes up to 3 pilots in the cockpit, where one of them is just an AI system, I guess, that you're just able to bounce ideas off of, just like you do with your co-pilots.
The other potential would be a remotely piloted aircraft as well, right? So do you need to put the pilot in the flight deck, or can one pilot be managing 5 different flights? Kind of vis-a-vis what we do with drones, right? So that's the other potential. I think you have a hard time getting public to fly in a plane that doesn't have a human at the front of the
Flight.
The front of the plane. Many of the travelers are quite anxious, and seeing flight crew members gives them huge reassurance. So I think airlines would have a tough sell selling a ticket on a pilotless airplane. Maybe the lead example of that would be like the Wemos we see in San Francisco, where it's the automated autonomous driving taxis. So we saw those. I never got in one because I didn't trust it, but I wouldn't walk in front of it because I didn't trust it. Like, is it going to wait for me to cross at the crosswalk? I'm kind of like, I just stood there and there's no communication because I couldn't make eye contact with a driver just so that I knew that they knew that I was walking. No, this is an autonomous vehicle. Well, I didn't trust it, and I'm a pretty big tech guy. So I think we have a lot of issues when it comes to trust in that type of autonomous operation to get the flying public on board.
I guess it is hard to tell really which way it's going to go. You can only assume.
The last episode that we had was with a postdoctoral fellow that's looking into more of the human factor side of pilots to improve certain aspects, as well as she looked at men versus women and their individualistic characteristics of what makes one different than the other. But one aspect that we talked about with her that I think applies to our topic right now is how much of humanity functions in aviation itself. You're right. We have a lot of nervous flyers, and having a physical person there provides a lot of emotional relief in ways that people don't realize. And I think to your point, whether it comes into play, whether we have single pilot operations or not in such a grand scale, one thing that we need to remember is just the role that humans play in the flight deck.
Yeah, exactly. Like, we're here to connect people.
Yeah.
And it's people connecting people, not simply just a metal or carbon fiber tube that's connecting people. And I know for myself, when I do the flight, at the end of the flight, I go back and I say bye to pretty well every passenger I can. And I do that because it's my way of connecting with them, but it's also my way of connecting with, so that they connect with me to say, oh, okay, that's the individual who got us here safely. And, I'm sufficiently important that he came back to say goodbye to me. So there's some customer relation involved there too. But I think that goes a long way to reduce long-term anxiety for people if they have that constant view of a flight, whether it be the captain or first officer at the end of a flight. I think it makes a big difference. So it's, my advice to my fellow airline pilots is say bye to all the passengers. They're the reason why we're there.
Based on our discussion today, is there anything you think we should have talked about that we haven't?
I think we've covered off quite a bit of broad area. Yeah, you've hit most areas. So, it's been great talking to both of you, and I appreciate you having me in the studio.
Yeah. Very interesting discussions. I know we bounced a lot between your journey and then the aviation journey, medicine, advice, life advice, flying advice. But I think it's just so relevant for not only us in such an early stage of our careers, but others that could be starting, could be just getting the bug, or have been here for a while, and things that they can take, even if they've been in the industry for 30 years, what can they do differently? And I think what you've talked about today, it will greatly influence a lot of our listeners out there. So thank you for your time, and we appreciate you being here. And with that, to our viewers, we also want to thank you for episode number 13. We wish you all blue skies and tailwinds ahead. We'll catch you next time.